The term start your life healthy and then stay healthy does not mean to start up with proper nutrition through breastfeeding. You have to start up much earlier. You have to look at the women during adolescence and when they are young, 16, 18, 20. What do we have to do to make sure that their nutrition is okay and the baby will be okay?
Well, thank you. And I think what we are beginning to recognize is, firstly, as you pointed out, that our target age in terms of counseling, advice, nutrition interventions is now inclusive of adolescents who are very young, who are currently not being captured as part of the health system and have difficulty accessing care and services. But the other important thing that we are also cognizant of is that care for a mother and a newborn and a young child actually does not start with the pregnancy itself. It starts with being well prepared for that pregnancy. So every pregnancy needs to be, number one, wanted, number two, welcomed, number two, being prepared for. And that means that everybody should have access to education, information, the appropriate nutrition and health services in anticipation of starting life normally, optimally, in the best possible state. And for certain nutrition interventions, we know that the benefits that you get, both in terms of the mother and the baby and in terms of long-term outcomes, are significantly better if you start them preconception, before pregnancy conception.
You were addressing something which is very important. The medical profession is trained to treat diseases. And here you need something completely different. Who should do this? Do we need a new class of health workers, or is the government responsible? How can this be organized in a developing country? For example, in your home country, in Pakistan.
Well, it's very clear that we need to bring a conceptual framework around this, which is inclusive of prevention, promotion, and of course, screening, detection, and treatment. To give you an example, on something which is now a global epidemic, we can stay forever with a therapeutic side on this obesity epidemic. In my own country, people have just initiated what we call bariatric services for cure of people who are already obese. The expensive interventions around treating people with established hypertension and diabetes. A fraction of those investments in preventing those risks in the first place would yield much greater societal benefits and health outcomes than to focus attention on expensive curative services. So if, people say an ounce of prevention is worth more than a pound of cure. But doing that is tricky because physicians and practitioners are generally not as engaged, involved, or has as much authority on the preventive side as do politicians and policymakers. So I think on the issue of nutrition for adolescents, pre-pregnancy, there needs to be a consensus around what are the policy imperatives that need to be put in place to prevent some things that we recognize are a global epidemic, like obesity in adolescents, not being well prepared, drug abuse, issues around lifestyle, issues around education and awareness of sexually transmitted diseases or reproductive health. These are huge issues which are not just developing country or low-income country issues. They're just as important for developed economies where many of these adolescents are people who have no access to healthcare services and insurance.
Who should lead the global strategy? Is it WHO?
I think WHO is the norm-setting organization, and it is absolutely much better placed than others to initiate this. But I think in terms of who provides the impetus for translating this beyond just words to action, it would require a collaboration between the norm-setting public health bodies, civic society organizations, NGOs, and particularly organizations that deal with young people. At this point in time, globally, the young people are the most interconnected. And they use media, they use social media in inventive ways, and they have their own dynamic in terms of information flow and in terms of access to things that make differences to their own lives. So I think we need to bring them into this debate in terms of not prescribing what we think they ought to be doing or ought to be happening with them, is to also ask them how do they think this ought to happen.
What could be the role of the Nestle Nutrition Institute in such a internet debate? Education we provide.
I think I would say it's largely education, civic society awareness, but it's also a research and development agenda. So the Nestle Nutrition Institute has clearly a niche and an opportunity for continuing education, not just for the medical professional, but also for populations, civic society. So you should be doing much more in this area of optimizing nutrition and health.
Do you see any risk if this education is done via the social media?
I think if you select messages carefully, and particularly around where there is incontrovertible or clear-cut evidence of benefits, like, for example, healthy lifestyle through improved nutrition, better physical activity, exercise, appropriate dietary choices, things that have been identified in the recent global burden of disease studies, those kind of things everybody should be talking about. And why not Nestle Nutrition Institute? I mean, Nestle Nutrition is much better placed than many others in terms of also putting some of its R&D dollars behind the development of commodities and a pipeline that also not only reaches the well-off, but also has products that are of benefit to people living in less economically developed societies.
So in developing countries, you are mainly focusing on micronutrient fortification of products?
Well, around the whole issue of preconception care, there are both micronutrients and there are also things that have to optimize energy and protein content for populations that are at risk of being underweight or wasted. There is also the need for optimizing products that prevent obesity. So I'm personally very focused at this point in time on how do we optimize dietary choices, not just by commercial products, but also by educational messages that allow people to make choices for their diets in a more optimal manner. You may have heard the frequent term, it's generally the poor who have the worst dietary quality even when they go for short-term outcomes. Why? Because they generally have fat-rich food, they have foods which are generally from a non-balanced portfolio of products. And there is a great opportunity of changing mindsets. So I think organizations like Nestle Nutrition Institute have the resources, have the access to professionals with the education, training, and evidence, and certainly can play a major role in civic society education.
How do you see the role of the medical associations to provide proper education?
Well, the healthcare professional associations, particularly those that deal with these target age groups, be those pediatricians and obstetricians, are uniquely placed to play a partnership role around continuing education, around implementation through their constituent bodies in countries that need. They need to approach this through firstly being very clear on what the message is.
Are the health workers properly organized here?
Well, it depends upon what population fractions you're looking at. So most health professionals, as you know, who are members of these societies and associations are typically working in facilities, in urban centers, not necessarily amongst the most deprived population. Now, there are obviously exceptions, and there are lots of healthcare professionals who are also trying to break this inequity gap. But generally, their access to policy platforms is around facilities, hospitals, clinics, and primary care settings. But they have a huge societal role because they generally play a leadership role wherever they are. And there is nothing to stop building partnerships in developing countries of healthcare professionals and other care providers such as community health workers, lay health workers, people who are providing outreach services to create this partnership for people's focusing on common issues the key there is you must know very clearly what is the message and how do you all aggregate around that message.
But the internet will become more and more important in order to provide this kind of education and
the
communication.
Internet is a great equalizer. I look upon the internet as something that will revolutionize the way we seek information. It will also provide equal opportunities for disinformation at times. I think we all live with that. But in terms of a child or a parent or a woman in one of the remotest parts with access to internet, being able to access information where in the past it would have been impossible. Just look at the revolution that the internet has made in terms of access to evidence for even professionals. You don't even have to go and try and seek this out of textbooks or libraries. You have this on your handheld. It creates enormous opportunities for action. It also creates enormous opportunities for synthesis of some of these core messages and interventions in a way that people can implement them much faster and better, and also creates great opportunities for monitoring and evaluation.
Thank you very much.
Thank you.